How do anterior, posterior, and lateral hip replacement approaches differ? Imagine your hip joint as a ball and socket that helps you move smoothly. When osteoarthritis causes pain and stiffness, doctors may recommend a total hip replacement. But did you know there are different ways to do this surgery? Today, we're going to explore how the anterior, posterior, and lateral approaches differ and what that means for you. The anterior approach starts at the front of the hip, near the groin. Surgeons make a small incision here and work between muscles instead of cutting through them. This muscle-sparing technique often leads to less pain after surgery and a quicker recovery. Patients may be able to walk with less assistance and avoid some movement restrictions during the first 12 weeks. However, this approach can be more challenging for the surgeon because of limited space and the need for precise technique. Not everyone is a candidate for this method, especially if the patient's anatomy or medical history makes it difficult. Moving to the posterior approach, the incision is made at the back of the hip, close to the buttocks. This method involves cutting through some muscles and tendons to access the joint. It provides excellent visibility for the surgeon, making it easier to place the implant accurately. While this approach has been used for many years and is very reliable, it has a slightly higher chance of hip dislocation after surgery. To prevent this, patients are advised to follow specific movement restrictions during recovery, like avoiding crossing the legs or bending too far. Recent improvements have reduced these risks, and many surgeons now preserve more muscles during this procedure to help with faster healing. The lateral approach involves an incision on the side of the hip, more towards the outer thigh. It cuts through some of the hip abductor muscles, which are important for stabilizing the pelvis when walking. This approach is less common but is known for providing a very stable hip replacement. Some patients might experience a temporary limp after surgery because of the muscle cutting, but in the long run, outcomes are similar to other methods. When choosing the best approach, many factors come into play. Your body type, hip shape, previous surgeries, and your surgeon's experience all matter. All three approaches use the same type of implant, usually a titanium stem inserted into the thigh bone and a ball made of metal or ceramic. While the anterior approach might offer a faster start to recovery and less pain, the posterior and lateral approaches are still very effective and have a long track record of success. In the end, talking with your orthopedic surgeon about which approach fits your needs can help you recover better and enjoy your new hip for years to come. Each method has its own strengths and considerations, so understanding these differences can make your decision easier.